All right, let's unpack this. We're tackling a really key question today. How do you know if your body has enough fuel, enough iron? So our deep dive is all about the ferritin blood test. And we're using a specific guide, one focused right on Rotherham, from the website Blood Test UK. Our mission, pretty simple, really. We want to quickly get what this test is, and maybe more importantly, why taking it actually helps you stay healthy.
Right, so ferritin, think of it like a protein. It's a storage jar, basically, for iron inside your body. Checking this test, it shows your body's iron reserves. It's really essential because it tells us if you've got maybe too little iron.
Which makes you feel tired. That's anemia, right?
Exactly, anemia. Or the flip side, maybe too much iron, like in a condition called haemochromatosis.
Okay, this is where it gets really interesting, I think. The guide from Blood Test UK mentions regular testing helps you, manage your health proactively. So what are the big upsides?
Well, the biggest benefit, honestly, is early detection. Spotting low ferritin early on means simple changes, maybe like diet tweaks or taking vitamins, can stop serious anemia before it starts.
Okay, that makes sense for low iron. What about the high side you mentioned?
Yeah, if levels are too high, like with haemochromatosis, finding out early can actually prevent damage to your organs.
Yeah.
Your liver, your heart. The Blood Test UK guide notes that people in the Rotherham community who get a handle on their ferritin levels often report just feeling better overall, more energy,
That prevention aspect for high iron sounds critical, especially if it's silent.
It is. Haemochromatosis often doesn't show symptoms for a long time. The iron just builds up. So this test can catch it way before you'd feel anything wrong. It's often the very first sign.
But hang on, does high ferritin always mean iron overload? I feel like I've heard it can mean other things too.
Good point. No, not always. And that's super important. Ferritin is the storage protein, yes, but it's also what we call an acute phase reactant, meaning inflammation can make it go up.
Yeah.
If you have a cold or maybe arthritis or some liver inflammation, your ferritin can spike. And that spike might have nothing to do with your actual iron stores.
Okay, so a high number needs a closer look. It could be iron, could be inflammation.
Exactly. That's why just getting the number isn't enough. You need that interpretation.
Got it. So understanding why we test, preventing damage, checking for inflammation, how does someone in Rotherham actually do this? Where do they go?
Right, the localization part. The Blood Test UK guide is pretty clear here. If you're going through the NHS in Rotherham, you've got options like Rotherham General Hospital, also Montague Hospital. But, if someone wants faster service or maybe just prefers a private setting, there are private clinics too, like the Rotherham Health Center. They offer the test as well.
And getting ready for the test, the guide from Blood Test UK lays out some simple steps for the best results.
Yeah, 3 main things. They're pretty straightforward, but really important for accuracy.
Okay, number 1.
You have to fast for 12 hours beforehand. And that means only water, nothing else.
12 hours, just water. Why is that so critical for ferritin?
Well, if you've eaten recently, especially something high in iron, it can temporarily affect the iron moving around in your blood. That might mess with the reading of your long-term stores, the ferritin. So fasting gives a true baseline.
Makes sense. What are the other 2 rules?
Second, tell your doctor absolutely everything you're taking. All your medicines, any vitamins, supplements.
Okay.
And third, try to avoid any really hard exercise the day before the blood draw. Intense activity can sometimes skew the results a bit too.
Right. So fast, tell your doc everything, and take it easy the day before. Simple steps for good data.
Pretty much. Preparation is key.
So if we connect this all back to the bigger picture, this guide from Blood Test UK really seems to emphasize that knowing your iron status, knowing that ferritin number, it empowers you, right? It lets you make smarter choices about your diet, maybe your supplements, just your overall health, puts you in the driver's seat with your body's fuel tank.
Absolutely. And it actually raises an interesting question to think about. The guide mentions that intense exercise, especially for athletes, can sometimes temporarily lower ferritin levels. So knowing your own specific iron status, not just if you're low, but what your actual storage capacity looks like, how might that change how you approach your training? How you plan your recovery, maybe adjust your nutrition around your workouts or your favorite sports. It's definitely something for you to chew on.